And now, please welcome to the stage Dr. Dora Hughes, CMS Chief Medical Officer and Director of the Center for Clinical Standards and Quality. Also, Dr. Michelle Schreiber, Deputy Center Director for the Center for Clinical Standards and Quality and Director for the Quality Measures and Value-Based Incentives Group. Also, please welcome Dr. Sherry Ling, Deputy Chief Medical Officer. And Improviser Extraordinaire Will Harris, Acting Deputy Director.
Thank you so much, esteemed colleagues and friends. What a journey these past 2 days have been. Today's quality journey was a powerful continuation of our shared mission to make America healthy. We started this morning hearing from Deputy Administrator John Brooks. We had an amazing panel with our CCSQ SLT. We will continue with the acronyms, SLT, CCSQ Senior Leadership Team. That is also how we refer to our CCSQ group directors and deputy directors. After that, we were able to reimagine a system, noted that it was in capital letters for a new era of quality outcomes. We explored AI's role in advancing patient safety, and then we were able to formally celebrate Qualcomm style. Jean Moody Williams is our champion of patient safety advocacy. I struggled today, as I'm sure all of you did, again, with trying to decide which sessions among the tracks to go to. And so we thought we would again do a super brief recap, 2 minutes per person per track today. And so with that, I am going to turn over to Michelle. What were some of the high points, a key lesson, an insight that you took away from the quality track today? So in 2 minutes or less.
We talked about quality and safety, and I think the key take-home lesson is what we are going to do next. We heard from patient advocates, we've heard from technology, we've heard from others, and so the question is, what do we do now? In celebration of July 4th, which is right around the corner, Declaration of Independence, Constitution, birth of this country, what do we declare and what do we commit to? And we declare, number one, we would like to continue the quality conference. And number two, that we will always invite patients into this conversation and co-create quality and safety with our patients. So thank you.
All righty. So I had the honor of helping to organize and also participate in the Healthy Aging track. And in case anyone thinks that this is just about older adults, just know that today on day 2 of the quality conference, you are older, a day older, and therefore you have aged in a healthy way from yesterday to today. So healthy aging is about all of us. And we did learn from our first panel on healthy aging how important it is for us to realize what the risks are for surgical care. And it's not what you think. It is beyond the degree of the surgery or the risks associated with anesthesia. It actually is about your functional status or your frailty. And that's important for decision making, right? Risks versus benefits. And we also learned that there are tools available already for clinicians and patients alike to navigate care planning, e-care planning. And finally, just in case we need a little extra help, we also learned that the systems are being prepared through geriatric surgery verification, thank you American College of Surgeons, to prepare for the worst in case that happens, but hope for the best. And we learned of new technology, including wearables, that could be used to assess important elements of who we are under our skin, including function with tremendous clinical implications. And rounding it out are anchors of a future state for age-friendly. What matters most, mentation, mobility, and avoiding medications that could threaten your risk of successful aging across the care continuum. So really delighted that we will continue this. This is about patient safety as well as person-centered care that is meaningful, that we can all enjoy. and I, as a new Medicare beneficiary, I'm counting on it. So, well.
Absolutely. I had the really great honor of being in the conference room with the breakouts on improving organ transplantation across the country today, including one that I just spoke at along with a couple of my colleagues, another from the CMS Innovation Center and another from HRSA, who know far more about the subject than I do, so I'm glad that they were there. But we had a really great conversation with the audience about the work ahead of us on improving organ transplantation for the tens of thousands of people who are waiting for a life-saving organ. We know we owe it to them and to the country to make sure that that system is working well, working efficiently, and working smoothly. That's something that we're going to be digging into and remaining focused on in the weeks, months, and years ahead. So I'm excited about that. That was the most recent one. I'm going to go backwards. The middle session that we had was really the most impactful for me because it featured two voices from patients who have been getting treatment for ESRD for many years, both of whom have had kidney transplants and are now living with those and can attest to how the system treated them, how the transplant changed their lives, but also what their journey was like through their entire experience with kidney disease. That was very powerful for me. It was incredible to hear from them, and I'm so glad that they had the opportunity to tell their stories to everybody who was in the room and to be here with us. So that was incredible. The first session that we heard about was also incredibly exciting about the future and the cutting edge of technology that we're on xenotransplantation and the promise that we might see from being able to transplant something like a pig kidney into someone who can then benefit from that life-saving organ in a system where we know that available organs are too scarce. So it was an incredibly exciting and inspiring afternoon for me. I hope it was for any of you who were in that conference room with me, and we're looking forward to continuing that work ahead. Thanks, Dora.
Thank you. I failed to introduce Will Harris, Deputy Director, Sherry Ling, CMS's Deputy Chief Medical Officer, Michelle Schreiber, also Deputy Director and also the Director of our Quality Measurement and Value-Based Incentives Group. So now it's over to you, just as we did yesterday. We're hoping that you will share what new idea you learned, if you had a cool conversation, a new insight, particularly if it's a way that it will influence how you practice, how you do your work. We'd love if you could share those on hashtag QualCon25. Perhaps even more importantly, we're already looking to next year, and so if you have some topics that you want to suggest, areas that you want to dive in a little deeper, speakers you might suggest, perhaps you want to volunteer yourselves, we'd love if you shared that information at hashtag QualCon25 as well. For us, the conference is over, but we know this work will continue. Let's leave here not just inspired, but committed. Because together we are not imagining a better health system, we are actually building it. We are so excited to have your passion, we're so excited to have your presence, and we're so excited to have your partnership. Thank you so much for joining us this year, and we can't wait till next year to continue this conversation. Thank you so much.
Thank you.